Hi, how are you doing today?
Hi, how are you?
Hi, my name is Stacey. I'm going to be your nurse practitioner today. I already washed my hands outside, but I'm going to use some alcohol here just to make sure. You should always carry around a little bottle of alcohol, or always wash your hands. Okay. It's nice to meet you.
Nice to meet you.
Okay. Do you know what today's date is?
Today is February 1st, 2013.
Very good. And where are you right now?
I'm in St. Elizabeth's.
And what's your birthday?
7588.
Okay. And your name?
Brittany?
Great. Good job. So she is alert and oriented, ×4. Why are you here today?
I'm here for my annual physical.
Good. So while we're chatting, I'm just looking, inspecting her, inspecting the skin. Skin looks warm, dry. You feel it. There's no moisture. She's not visibly sweating. There's no visible signs of trauma on her face. There's no scars, lacerations, lesions, acne, anything like that. I'm also checking the symmetry of her face. Her eyes are equal if you drew an imaginary line down the middle. Same thing with her mouth, her ears. Her hair looks good and healthy for a 24-year-old. She has equal hair, looks moisturized. You can also see if there's any tenderness or bumps or lesions or any redness, anything like that. Just good. Anything hurt?
Nope.
Okay. Good. Also, with her hair, there's a good quality of it. There's no bald spots. There's no grays, things like that. The eyes and ears, they're symmetrical. And her skin looks warm, dry, and normal. And I'm also going to check her capillary refill. I'm just going to squeeze her finger here and count how many seconds. It's less than 3, so she has good, and she's warm, which is also good for circulation. You know it's working. So I'm going to check her cranial nerve number 7, which is her facial nerve. And I'm going to do the motor part of it, which I'm going to have her raise her eyebrows. Good. And can you smile? Okay, and frown. Okay, good. Wrinkle your nose and your forehead. Very good. Can you shut your eyes and open? And can you close them really tight? Okay, open your mouth. Okay. While I do this, I'm going to check the mandible joint. Go ahead, open again. Okay, once more. Good. So I can feel the joint, it's opening and closing, there's no clicking, there's no, it's similar, and can you stick out your tongue for me? Good, and puff your cheeks out, and suck them in. Okay, very good. Along with the facial nerves, I'm going to check the cranial nerve number 12, which is her hypoglossal, which would be the sticking out the tongue. Can you swallow for me? Good. And the puffing up the cheeks, which she did. The cranial nerve number 5, the trigamental, going to have her clench her teeth for me. Okay, good. And open your mouth. I'm going to give some resistance. Good. It's a nice and strong jaw trying to open up with me there. And along with that, the cranial nerve number 5, I'm going to do the sensory part of it. So I'm going to use a cotton ball as the soft and a paper clip as the sharp. So I'm going to have you close your eyes and just let me know if I'm touching you with the sharp object or the soft object.
Sharp.
Good.
Soft. Soft. Sharp.
Good. So she passed that test. It's all intact and it's good. Next we can check the shoulders and neck. So the cranial nerve number 11 does the shoulders, the accessory nerve. And so I'm going to put some of this and have her shrug up. Good. And one more time. Good. So she's pushing up equally with both things. There's good strength. There's no crepitus. No different feelings. So from there, I'll move on to her ears, and on them. I'm just gonna check the alignment with both of them. And they look similar. There's no extra skin tags, or the pena's not larger on one side, or anything like that. The reciprocals are good, they're flat, and they're equal, which is good. I'm going to check her cranial nerve number 8, the vestibular, or audio. If you want, so I'm going to do the whisper test. So towards you, I'm going to whisper a word, and I'm going to have her repeat it for me. So can you close this ear? Good. Okay.
Apple.
Good. Very good. So she passed the whisper test, which is good. I'm also going to check the rind test, which I don't have a tuning fork, but this I'm just going to show how I would do it with the tuning fork, because the tuning fork, when you do hit it, it vibrates, and you can hear the vibration. So for the rind test, after I hit it, I'd put it right here on the mastoid, right behind her ear, and I'd have her tell me when she stopped hearing, feeling the vibration, and then I would put it right over here next to her peanut, and have her tell me when she stops listening to have it. Also, the Weber test, I would hit it, and I'll put it right in the middle of her head, and I'll have her tell me which ear she hears it more in. Hopefully it should be equal, but it should radiate through the bones equally. Some people hear it a little more than the other. So now from there, I'm going to use the otoscope, excuse me, and there you go. So I'll have you just look forward there. I'll just check the outside of the ear canal. It's there's no visible scars or lesions. I'll also look inside. There doesn't seem to be a lot of waxy buildup, which is good. Do you clean your ears often?
Yes.
Good, very good. So now I'll stick it in her ear, and I'll look. And I see the tympanotic membrane. I see the cone of light, which is good. It means it's bouncing off of it. I don't see any fluid, any discharge, any overly fluid or overly wax. And the wax that is there, it's a good color. It's clearish white, which means no infection. For the adult, I take the top of the ear and I pull it up and go in. For a child, take the peanut and pull it down and go in. So, because I didn't see anything on that, we'll check the other side. Can I have you look this way? I'm just going to pull up the ear. Again, check the outside. I don't see anything visibly there, no blood, no fluid. Also in the ear, there's no over discharge or fluid. And then I'll look in. And it looks good. It looks equal as the other side. There's no redness, there's no swelling, there's no fluid, there's no scarring, no inflammation or deformities or anything that would make me concerned. Have you been having any trouble with your hearing?
No.
Okay, good. So that's another sign that things are good. Also, you want to check for foreign bodies that are in there. Sometimes bugs can crawl in there. Little kids get little pieces of toy stuck in there, and you want to make sure you get that out before any damage is done. So from there, we'll move on to the eyes, and I'll visibly inspect her eyes. They're symmetrical. Her sclera is white. And the conjuncti is nice and pink, and there's no overly red blood vessels. Also the stack, the lacrimal stack is good. The eyelashes are equal on top and bottom. There doesn't seem to be any falling out. Same with this side. And the folds are normal on each side. And have you been having any changes with your vision?
No.
Okay, so that's good. And you use glasses, I see, which is good, so we'll have you use that for that. But first, I want to check, I'm going to check the sides of your pupil. So right on the side of my pen light, I have sizes, so I'm just going to have you look straight ahead. And that one is 4. 4, so her pupil size is equal. Again, I'll have you just look straight forward, and I'm going to check pupillary response. Good, and now I'll check, so when I put the light, they constricted with the light and dilated without the light, and they were both equal in size and in speed, which is important. I'll also check the accommodation, so if I shine it in one light, the other one should accommodate for it as well. So I'll shine it in this light, but I'll look at this. And she has good accommodation, which is good. So this is all part of cranial 2 nerve, which is called the optic nerve, and that affects the pupillary reflex, your visual acuity, and visual fields. So with the visual fields, I'm going to have you close one eye for me. Okay, open the other. Okay, and just tell me where you see my fingers. Which?
I see that one.
Okay,
Up.
good, yep, but I need you to keep looking forward, so.
Oh, okay.
Just tell me up. So we'll do 4, like there's 4 quadrants, and we'll do 1, 2, 3, 4. Okay, so just tell me which quadrant you see it in.
1.
Good.
4. 3.
4.
4.
Yep.
3.
Mm-hmm.
1.
Good.
2.
Good. And with the other eye?
1. 3. 4. 1. 2.
Good. So it's good if you have a visual aid, something like that, maybe you can make them different colors, and they can just tell you what color they see, because it's kind of hard to do the 4 boxes. The other part of the optical nerve is visual acuity, and that's with something called a Snellen test. Usually they have things like this, it's up on the wall, they have 20 feet back, and so I'm going to stand back here. You can put your glasses on for this part. And I'm going to have you read the line that, can you read the top one?
Yep. G.
N.
W. B. G. S. B. E. N. O. I. H. W. J. H. E. R. L. C.
And this is the last one, this is to the 20/20 vision.
N. O. S. Z. L. E. P. H.
Good. So she passed the acuity test with the Snellen chart. Next we're going to check cranial nerve number 3, the oculomotor, the cranial nerve number 4, which is the trochlear, and cranial nerve number 6, which is the abductans. So I'm going to have you follow my pen. And go in, good, and back up, and good. And now I want you to just follow with your eyes. Good, so they were equal, they were similar. They both went, they were both at the same speed. One wasn't faster or slower than the other. And they both accommodated for each other, which was good. I am